This is One on One. Hi, I'm Steve Adubato. We're coming to you from the offices of the Robert Wood Johnson Foundation in Princeton. We are honored to have Dr. Risa Lavizzo-Mourey, who is the President and Chief Executive Officer of the Robert Wood Johnson Foundation. It's great to have you with us.
It's great to be here, Steve.
Talk to us about the foundation. I mean, people hear about the Robert Wood Johnson Foundation and its size, its impact, but not a lot of people know the real impact. Talk about it.
Well, we are a foundation that's, as you know, the largest foundation devoted solely to improving health and healthcare in this country. But what we're really excited about right now is a vision that we have to build a culture of health in this country where we strive to ensure that everyone in this generation and in future generations has the opportunity to lead a healthy life. And that is what we're making our North Star at the foundation.
You know, it's so interesting. You know, a lot of folks who lead foundations have executive backgrounds, fundraising backgrounds, but not everyone who leads a foundation has the background you have. You're a practicing physician for a few years.
We don't need to talk about how many.
I'm just saying you have an impressive background. But what it talks about here is it breaks down, you know, in the foundation report what this culture of health really is. And it breaks it down in a way that is real for people. And I want you to help us with this, if you could, Doctor. It says that a culture of health means reversing childhood obesity epidemic. Break that down. What does that mean?
For more than 30 years, the trajectory of obesity in this country for kids has been going like that. We know that when kids enter adulthood overweight or obese, they have a much higher probability of having chronic illnesses like heart disease, diabetes, and that leads to disabilities and early deaths. So that by having so many kids with overweight or obesity as part of their makeup, we may be the first country that, the first generation that lives sicker and dies younger than their parents. And that is something that has never been a part of the way we thought about health in this country. So reversing that means creating the opportunity for kids to make the healthy choices the easy choices, so that when they go to school, there's healthy food, there's physical activity that's a regular part of their day. They learn about good nutrition practices and then they can take those home. And they can walk home, not ride a bus or take a car home. It's creating the opportunity so that every day, all day, we have the opportunity to make healthy choices.
But you know what's interesting? A lot of folks, from a public policy point of view, which you have an impressive public policy background, people will talk about doing those things. But the foundation, in full disclosure, the Robert Wood Johnson Foundation underwrites a lot of the work of public broadcasting and informing the public about important public policy, medical health issues has been a big part of the work of the foundation. But the fact is, everything you just talked about isn't something you just talk about from a public policy point of view. The foundation supports efforts to do those things. Talk about some of those efforts.
Well, we were just talking about what it would take to create a healthy environment for kids in schools. You can go to New Brunswick right now and see that in elementary school, kids are learning how to swim. And they have that opportunity to learn how to swim because now there's a new pool that's been built in New Brunswick that gives access to a new way for kids to be physically active. But it also, at that same fitness center, has classes and opportunities for kids to learn about nutrition.
Excuse me, is that through the Y?
No, it's actually a independent center right in New Brunswick.
Wait a minute. How do you find? It's not you alone. It's this terrific team you have here. Do you find community-based organizations? Is that the role of the foundation, to partner with groups who are in the community doing these things and help them do what they may not be able to do for themselves because they don't have the resources?
That's certainly a big part of it. Another big part of it is getting leaders who don't think of themselves as being a part of creating a healthy environment to see their work as helping people be healthier. If you are an urban planner or an architect, you may not think of yourself as someone who promotes health, but step back for a moment and consider whether or not their sidewalks or their buildings that encourage physical activity, that's all in the domain of architects and urban planners. So part of what we do at the foundation is, as you say, find people that are already doing the good works, but we also try to partner with them, people who can augment that and work across all the domains that are needed in order to create health. New Brunswick is a great example because there's great political leadership, there's business leadership, there's a vibrant civic engagement, and that's what it's going to take to create a culture of health. And what we do is look for that all around the state of New Jersey and the country. Camden is another great example.
Dr. Jeff Brenner, I know some great work has been done there. Talk about that.
Well, he's one of my heroes.
He's a role model.
He is a role model, and a role model for so many people, because what he did was he took data, the data that most people just look at and don't know how to make sense of, and he said, I can see that there are 5% of the patients in Camden who are using upwards of 50% of the resources. Why? Because they don't have the kinds of services that would keep them out of the hospital. Things like transportation, housing, access to prescriptions. And he said there's got to be a better way. So he began looking for different models, different people, nurse practitioners, medical assistants, anyone who would get engaged to provide these services that actually kept people out of the hospital.
And help me, what is the foundation was very involved, has been very involved in helping. By the way, for those of you who don't know, log on to our website, you'll find out about Dr. Jeff Brenner. Also, the foundation's website will help you find out about him as well and his organization. But a groundbreaking model, nationally recognized, community-based health, if you will. But what does the foundation do to help Dr. Brenner and his work?
One of the things that we did was provide the kind of funding that he needed to do this analysis, and then to provide him with the resources to connect all of these various providers that needed to come together. And probably the most important thing that we did was to connect him with people like you and others around the country who can tell the story. Because if you are doing great work in one place and no one knows about it, it's not going to spread.
Why is that important? Talk about that, because the public awareness part of this is huge, because you are supporters of public broadcasting, have been for a long time. Why is it so important for the foundation to help the public better understand complex public policy issues, medical issues, healthcare?
We in this country have, as a fundamental part of our democracy, people understanding the problems and how to solve those problems. So we've always felt at the foundation that we had a central obligation to find out what works and then to communicate that, and to communicate it in ways that people can understand. And often that means bringing the data into real-life stories that speak to people. Jeff Brenner's work does that so beautifully, because it shows how when you can't get the care you need, bad things happen to people and they end up in hospitals. Communicating that in the ways in which he's able to change that has become a model for delivering care all around the country that people are now picking up and trying to replicate.
Thank you, Doctor. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, Wells Fargo, Robert Wood Johnson University Hospital, MD Advantage, New Jersey Natural Gas, Activists, in cooperation with the American Medicine Chest Challenge, and by the Fidelco Group. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.